over here with me now. It's 14 minutes to 9. When the COVID-19 pandemic made its way to New Zealand earlier this year, many of us were worried and confused. In an effort to ease that anxiety, GP Dr. Sandhya Ramanathan made a short video to help her patients. Then, as case numbers went down in New Zealand and shot up overseas in India, Sandhya's cousin got sick, so she filmed an 18-minute video in one go explaining how to manage a mild case of COVID-19 from home. It has had more than 370,000 views on YouTube and millions on WhatsApp. Now Sandhya is helping hundreds around the world from her Auckland home office, where she joins me now. Morena Sandhya, thank you so much for joining us this morning. We really appreciate it.
Oh, good morning, and thank you very much for having me. And summarising that story in a nutshell.
Yeah, you're famous. You're famous around the world. You've gone viral.
Well, ironically, yes, but happily, it's good news that went viral. And I'm totally blessed that I could make a difference from, as you said, my home office.
Yeah, talk to us a little bit about how this all did start for you.
Well, I suppose, obviously being a doctor myself, and I would call myself a global citizen. I'm actually Australian, but I've proudly Kiwi for the last 12 years. And obviously, I've been born in India. And so, obviously when the pandemic hit, it hit very personally to me, being a doctor. My husband being a doctor, and most of my, obviously my family and closest friends being doctors. So, the understanding of all the information that was coming out was essential for me, because I needed to understand how could I safely navigate this pandemic? How could I keep myself safe? How could I keep my family safe? How can I keep my patients safe?
Because sorry to interrupt. One of the big things you talk about is, the fact that a lot of us know what to do to prevent ourselves from getting COVID, wearing a mask, coughing into your elbow, all of that kind of thing. But there's not a lot of information about what to do if you actually get COVID-19, is there?
Well, exactly. And this is one of the things which I just couldn't understand. I mean, I was busy sort of breaking down, decoding all of this information on social media for the lay people. And I was just like, is it just me, or is it that nobody's actually addressing the fact that we're talking about the elephant in the room? Let's talk about the elephant in the planet. That the vast majority of people, unfortunately, are facing these terrible circumstances, which I address in my video, which is, what do you do if you think you've got COVID, but you can't access a test and you can't go to hospital? Now, this exact set of circumstances faced my cousin, and I got the call saying, look, I've got a bit of a dry cough, a scratchy throat, and a bit of a fever. Now what do I do?
And what do you do?
Well, you do exactly what I talk about in my 18-minute video. And what I've done is I've basically gone back to the basics. I mean, I've been doing my own research, and every article that I've been reading, rather than focusing on the problem, I've been focusing on what is the solution. Where is the information in here that can help me survive? So one of the very key things which I bring up at the beginning of my video is I discuss pulse oximetry. Now, this pulse oximeter device is something that's really cheap and affordable, even cheaper in a lot of other countries apart from New Zealand, like India, for example. And as soon as I started seeing reports from New York that patients were collapsing, and there was this terminology of happy hypoxia, of people having very low oxygen saturations yet still talking on their phone, I thought to myself straight away, oh my goodness, everybody needs a pulse oximeter, because the only way I'm going to be able to guarantee that, if I treat my family virtually, that they're going to be fine is if they can tell me what their SATs are reading at. So again, that was just a fundamental, and also, I broke down what are the basics of treating any upper respiratory tract infection into 3 simple steps that people could follow. And in doing so, I basically empowered them to look after themselves, So actually, I think one of the biggest thing my video did was actually it just spoke to that abject terror that people were feeling. Yeah. What do I do? What do you do?
So where can people find you if they want to go and have a look at this video? On YouTube? They just...
Oh, yeah, I'm on YouTube, and I've also uploaded it on Instagram, so you can look me up also on Facebook. I've got a public forum, Dr. Sandhya Ramanathan, where I post as much useful information as I can to help people, you know, and help families, just with common sense, practical tips that you can apply to your daily life.
Love it. Hey, thank you so much, and we'll put a link to that up on our Facebook page. That is Dr. Sandhya Ramanathan. We really appreciate it.
Thank you so much for having me.
It is 8 minutes.